The overhaul of healthcare, giving millions of women free access to a host of critical services. Starting next year, all private insurance plans will be required by the government to cover preventive care without a copay or deductible. Now, that includes medical screenings, domestic violence counseling, breastfeeding support, and birth control, despite some strong opposition from conservatives. Michelle Malkin is a columnist and Fox News contributor and joins us live. All right, Michelle, before we get to the moral or ethical question here, let's first of all talk about the fact that this feels like yet another government mandate on health care.
Yeah, certainly feels like it, looks like it, smells like it, and in the end, it will operate like it for all of these private insurers who are being forced to pay for it. And you know, every time we talk about a free piece of coverage, you need those ghost quotes around free. The White House denies that this is going to result in premium increases, but how else are these private companies expecting to pay for this, other than passing on the costs to the rest of its customers, clients, and folks who subscribe to their insurance plans? I think that, yes, setting aside the moral and ethical questions, there are some serious questions here about the process and the lack of transparency. And I think this is a good object lesson in how Obamacare top-down mandates work, because it was the Federal Institute of Medicine who sort of went through the dog and pony show of deliberating upon this decision, then handing it over to HHS. And of course, there's very little public oversight into how that decision was made. And in fact, there was a dissenter on the panel who blew the whistle on concerns that he had that this was all based on subjective interpretations and soliciting opinions from folks like Planned Parenthood without equal feedback from folks in the pro-life community who were against it.
Yeah, and we're definitely hearing some pushback from them today, because when you talk about contraceptive, my understanding is this is also going to cover what's called the morning after pill. And there is great disagreement in some quarters about exactly how that operates, if it would cause an abortion, if it would stop a pregnancy before it begins, and depending on your definition of that. But because there is so much disagreement about that among some, it seems an interesting step for the government to be telling private insurers they've got to cover something that for some people amounts to an abortion.
Yeah, that's right, Shannon. And a couple of points about all of this. For one thing, you've got a lot of the feminist, leftist groups who are heralding this decision as some sort of quote-unquote preventive care decision. But as a lot of the pro-life folks and people who oppose this top-down mandate have pointed out, in fact, what those groups are heralding the most on the left are after the fact, post hoc methods like the emergency contraception, the morning after pill, de facto drug-induced abortions. And there are a lot of religious health providers out there who object. Now, the White House's response is, well, we'll still have a conscience clause exemption, so they won't have to be forced to cover these things. But as many folks who have watched these battles play out over the last couple of years during the Obama administration, those religious freedom exemptions have become narrow and narrower and more harder to invoke over the course of this administration.
All right, just to take us out, I thought it was very interesting. You were tweeting about coming on to do this story, and we've been teasing it and getting a tweet online to both of us saying, what a crock this is. Why should I have to pay for that if I have to pay a copay on my heart medicine? So we know there's going to be plenty of backlash from folks out there about picking and choosing, you know, what you're telling private insurers they've got to cover. Michelle Malkin, thank you very much.
Yep. You bet. Thanks, Shannon.
Well, the